So University Hospitals is located in Ohio. It spans 15 counties, consists of 18 hospitals, and over 40 ambulatory locations. At such a large organization, we have been successful with the centralized PAC system that we have. We've also been successful in recently implementing vendor neutral archive, which is also better known as the Enterprise Image Management System. So at University Hospitals, our Enterprise Image Management currently consists of radiology and cardiology. We're actively working with ophthalmology, dermatology, and point-of-care ultrasound from our emergency department. And we are looking to expand, we're just in the discovery phase, the ability to acquire images at the bedside with a portable device and put that into the patient record. So we decided to deploy a VNA in order to create that single repository of the images, that single knowledge database of where those images reside, and to bring all the images together into a single location. We're also utilizing Sectra ortho tools. We're also utilizing Sectra Dose Track, and we're also utilizing Sectra Image Exchange Portal. The ortho tools we've been using for many years, and it's really easy product. It's seamless to our ortho physicians. We were able to eliminate the need for film to be printed for ortho templating, and they update the templates on a routine basis. And you can also get templates added as requested from the vendors. The dose tracking is really something that's not forward-facing to the general users. It's utilized by the physicist, but it's very easy to integrate the modalities as they come on and hook them up to start sending that dose information to the dose tracking system. And then the image exchange portal is new to us. We are still in the implementation process, but the advantage of being able to share images electronically is going to be huge for our organization, because we create and send CDs and receive CDs from all around the world. So moving down the road, other areas that we're going to include in our enterprise image management would be the GI lab, individual modalities that you find in the intensive care units, and then of course pathology, as we're entering the digital pathology world, and this will be a large benefit to our radiologists and to the physicians caring for the patients. So the advantages of utilizing a single vendor across the enterprise image management system is the ability to view the images on a single platform, no matter what location you are going to. If a physician is at facility A for a patient and that patient had an exam at facility C, they would still have access to it. That is key. One feature in our single enterprise solution is what's called a connectivity hub. As we have grown, we acquired other hospitals, and during that acquisition, those hospitals had their own systems. So as part of the integration, we were able to integrate those patient records into a single patient record, which is key for the patients and for the physicians. The enterprise image management offers many advantages. One is cost savings. As far as if you're going to take on new hospitals, you reduce the cost for migrations. It reduces the cost if you're going to change out the front-end viewing application. You don't have to go through the migration process if those images already exist in the enterprise image management system. The other cost savings is image lifecycle management. Today, from what we've experienced, we've not been able to necessarily purge the electronic records because there wasn't an easy way to do it. So with the VNA, that's one of the functionality that's included, is the ability to purge the records based on a site's retention policy. Another cost savings would be the maintenance of the hardware. Previously, you could have 3, 4, 5 different hardware archives, different for each location. Now it's centralized, so you're not having to manage 5 different setups. You have a single server storage solution on the back end. Although it can support multiple, but as you replace that hardware, you can grow that and see that cost advantage. And the greatest benefit is to the patient, because the physician has at their fingertips in a single system that entire patient record, no matter where they see the patient, no matter where the patient had their exam performed. So from an IT perspective, the benefit of going to an enterprise image solution would include utilization of resources, utilization of hardware, software, licensing, support. So if you were maintaining 3-4 different back-end archives, you have licensing with each of those vendors, contracts with each of those vendors. So then you're looking even at legal resources, purchasing resources to be able to pay those vendors, contract with those vendors. Even so, it doesn't just boil down to IT, it really boils down to the whole organization. The advantage to a physician, whether it be a radiologist or a physician caring for the patient, of having a single image record for a single patient is priceless. The physician has all the information they need when it comes to an image record for a patient, regardless of where the patient had the exam, regardless of where the physician's located, and that gives them the opportunity to provide the best care for the patient. So as a facility, if I was seeking to roll out an enterprise image solution, I would definitely consider the workflows, where the images reside, the migrations needed, the other vendors needed, the viewer that you want to utilize, the experience you want to give the user, and to include the user and to understand what their current workflow is and then present to them the future workflow, which is where you're going to get the buy-in. Health systems should really consider Sectra because they have an intimate relationship with their customers. They listen to the customers, and you see the end results. And they include you in the development, they include you in the discussions of what their future roadmap is, and they get your feedback and they do listen. I think Sectra as a whole IT healthcare provider, they provide multiple solutions that gives you that single package. So you're not having to go to different vendors for multiple solutions. You can do a one-stop shopping with them and get the tools that you need, which to me, in my opinion, is key for many reasons: cost savings, resource savings, and then familiarity with the company and that partnership and relationship.